Hello, my name is Emma, and today I'll be guiding you through companies and careers relating to government and the health system. Specifically, I will give special attention to a current job posting at Joseph Brant Hospital for a medical lab technologist in pathology. To begin, let's first explore 6 career opportunities centered around healthcare. Firstly, St. Joseph's Healthcare Hamilton is currently hiring for a pharmacist. In this role, you will be identifying, inhibiting, and resolving any drug therapy problems that emerge in order to optimize patient care. Moving on, at Stevenson Chiropractic and Wellness, a registered physiotherapist will work to assess, create, and communicate appropriate treatment plans to patients and other team members. As a clinical psychologist at the womb, you will counsel and work with clients through topics of grief, loss, fertility, anxiety, postpartum depression, as well as other mood disorders. Furthermore, Circle Studios is currently hiring for a traditional Chinese medicine acupuncture practitioner. In this role, practitioners treat patients through holistic treatments like herbal medicine, acupuncture, breathing therapy, and massage. A dental hygienist at McDonald Dental performs procedures like cleanings, scalings, and polishing teeth. As well, the position includes assessing and educating patients on oral health and preventative care. Lastly, also the focus of this presentation, a medical lab technologist, specifically in pathology, works to gross biopsies, perform special stains such as the IHC stain, assess stain adequacy, process cytology specimen, and maintain, test, and calibrate equipment used. So, you may be wondering, what exactly is Joseph Brant Hospital? Well, a short summary would explain that Joseph Brant Hospital is a full service, acute care, nonprofit community hospital located in Burlington, Ontario. Being the only hospital in Burlington to offer acute care, Joseph Brant Hospital serves as a healthcare focal point for residents of Hamilton and the area municipalities of Halton. The hospital is located in the Hamilton, Niagara, Haldimand, and Brant Local Health Integration Network, or LIN number 4 for short, and is a partnered member of the Burlington, Ontario Health Team. Joseph Brant offers an abounding number of services, including but not limited to surgery, emergency care, diagnostic imaging, rehabilitation, cancer, and laboratory services. Not only is the hospital a teaching hospital affiliated with McMaster University, the campus also features an exciting laboratory that offers pathologists an innovative environment to perform tests and stains. So, what exactly is a pathologist? Well, within the laboratory, a pathologist's job focuses on studying the causes, indicators, effects, and nature of diseases on the human body through a microscopic and macroscopic lens. The process first begins with obtaining samples of tissue, bodily fluid, and organs from a patient, where an assortment of diagnostic techniques will then be used. Techniques used depend on the sample retrieved. However, common skills include grossing biopsies, which is the process of inspecting and processing tissue for diagnoses, and performing frozen sections in order to analyze microscopic samples of specimen. Furthermore, performing special stains like immunohistochemistry to microscopically observe cell types and processing cytology of specimen to look for abnormal cells are routine as well. Images of what the stains will look like after processing are underneath each of the labels. By analyzing the retrieved samples with the goal of diagnosing the disease at hand, the pathologist will then create a pathology report documenting all the findings and the supported diagnoses. An example of a pathology report is shown on the right, where the staining photos as well as the final diagnosis is listed. Commonly, a pathologist will need to conduct autopsies on specimen without a diagnosis in order to determine the illness at hand, furthering personal education. As such, a pathologist's primary responsibility is to analyze the large amounts of biochemical and genetic data obtained through employing data analysis tools in order to discern a patient's illness. So, focusing more on immunohistochemistry staining, we can observe how such a common technique can be so powerful and important for pathologists to classify cells and make diagnoses. An example of how the technique works can be observed on the right. Essentially, by exploiting the specific binding between antibodies and antigens, certain antigens can be detected and localized back to a specific cell or tissue, and from this, cell type and organ of origin can be determined. So from this description, we can see a very targeted application of immunohistochemistry in classifying neoplasts, which are essentially growths of abnormal tissue, and determination of tumor origin sites. Recently, the use of immunohistochemistry has expanded to predictive and prognostic information for various cancers, such as testing for amplification of the HER2 protein in breast cancer cases. Truly, immunohistochemistry is a pillar in modern-day cancer diagnosing and treatment. A common use of immunohistochemistry lies in the genetic testing of mismatch repair proteins in relation to endometrial cancer. Hereditary endometrial cancer is most commonly caused by Lynch syndrome. Lynch syndrome is an autosomal dominant inherited illness caused by germline genetic mutations in one or more of the mismatch repair genes, and the genes are listed on the slide. These mutations lead to defective mismatch repair proteins and consequently lead to microsatellite instability in Lynch syndrome cases. Therefore, the presence of microsatellite instability alongside the lack of one or more mismatch repair proteins commonly lead to the diagnosis of endometrial cancer. The presence or absence of such proteins can be identified through immunohistochemistry staining, making the technique a recommended starting point for genetic testing of hereditary endometrial cancer. If one of the mismatch repair proteins are indeed found to be missing, further germline genetic testing for Lynch syndrome would be conducted on the patient. However, immunohistochemistry is not limited to just cancer diagnoses. The staining technique can also be used for confirming infectious agents, detecting brain trauma, and diagnosing muscle diseases. In terms of infectious agents, immunohistochemistry can be used to confirm and detect viral and bacterial pathogens within unfixed tissue samples in animal pathology, so this includes humans, by using specific antibodies against possible DNA or RNA microbes. This allows for the infection's target and the progression of disease to be visualized within the affected tissue. When immunohistochemistry is used to detect brain trauma, the staining technique can determine the presence of beta amyloid precursor proteins, and these can be used to detect axonal injury within 2 hours of possible head trauma, allowing for an accurate timeline of the injury to be established. Finally, abnormalities in several proteins within the muscle have been connected to muscular dystrophies, such as proteins found in the cytosol, nucleus, extracellular matrix, and other areas within muscle fibers. When a protein abnormality is found, immunohistochemistry can be used to determine the exact muscular dystrophy taking place. Lastly, let's just quickly glance over the pathway towards becoming a pathologist. A pathologist is a certified medical doctor that specializes in laboratory techniques and diagnostics. As such, the first step is to obtain a medical degree. There's no specific program required to apply for medical school. However, it is recommended and very common to complete an undergraduate degree in biology, health sciences, biochemistry, or related science fields because the required courses in undergraduate degrees commonly overline with what you'll be learning in medical school anyways. Afterwards, you will need to take the MCAT, CASPER test, as well as other supplementary applications to apply and get into a med school where you complete a 4-year degree. Afterwards, you will apply for 5 years of residency in general pathology, and then afterwards, you must pass the general pathology certification examination in order to receive a Royal College certification in general pathology. Finally, the student must register with the College of Medical Laboratory Technologists of Ontario, where you can then apply for any jobs within the field. So all in all, we can see how important of a role pathologists play in the healthcare sector. We can see how large of a responsibility lies on their shoulders, where everything between communication with other team members to diagnosing the disease at hand falls in their hands. I hope from this presentation you can see how important pathologists are within continuing the flow of healthcare for patients within Ontario, but not only Ontario, but around the world. I hope you enjoyed the presentation. Thank you very much for listening.